We're going to look at some of the similarities in terms of symptoms and treatment for IBS and IBD. It is interesting to examine these because it allows for expanding our treatment options for both and the targets of treatment for both. So far to date, there has been no data to support that IBS increases the risk of developing IBD or colon cancer, in which ulcerative colitis increases the risk of colon cancer development. Also, IBS, thought of as absent of inflammation, but research is showing that the trigger is not only an infection, but inflammation caused by this infection may trigger IBS, so there actually may be more of an inflammatory part to IBS than we originally thought. This draws some similarities to IBD since inflammation is so paramount in the pathology of IBD. In an interesting study showing the inflammatory aspect of IBS, researchers showed that mesalamine, also known as 5-ASA, an anti-inflammatory drug to treat ulcerative colitis, improved abdominal pain and stool consistency in diarrhea-predominant IBS, showing that similar treatment methods were effective in both conditions and could be cross-applied. In another study, TCAs, or tricyclic antidepressants, commonly prescribed for IBS, were shown to have an effect in managing moderately to severe function symptoms like abdominal pain and diarrhea in IBD. They found most benefit in those suffering from ulcerative colitis as opposed to Crohn's, showing once again a crossover in symptom management with common treatments for each respective condition in the other. When examining the symptomology of IBS in IBD, we find that about 57% of patients with Crohn's and 33% with ulcerative colitis who are in long-standing remission actually have IBS-like symptoms, so actually present with the same symptoms as someone with IBS when they are not suffering from the symptoms of IBD. To compare this to healthy people, another study showed that about 41% of Crohn's patients suffer from IBS symptoms, while 31% in ulcerative colitis had IBS-like symptoms. This was compared to only about 7.6% of healthy controls, showing a significantly higher rate of IBS-like symptoms in IBD patients compared to a healthy population. This leads us to see IBS symptoms seem to be quite high in IBD patients, allowing for us to theoretically provide similar symptom management treatments due to the same presenting symptoms. IBS is thought to progress from gut dysfunction, also thought to possibly be from an infection in the gut. This leads to inflammation and then immune activation. IBD, we don't know the exact trigger, but it leads to inflammation and immune activation and is thought to be autoimmune in nature. So we see some similarities in terms of inflammation and immune activation between the two. When looking at genetics of these two conditions, there also seems to be similar genetic mutations. The etiologies of these conditions seem to be quite similar, present with similar and very different symptoms at the same time. When looking at the disease process and the progression of IBD or inflammatory bowel disease, it is shown that IBS symptoms may actually and do precede the diagnosis and development of IBD. Patients who eventually are diagnosed with IBD seem to exhibit symptoms of IBS before a diagnosis is actually made, which this could be a reflection of gut dysfunction commonly found in IBS that generates subclinical inflammation and progresses to more inflammation that we see in IBD. It is quite interesting to examine how these conditions relate and how they progress in the symptoms they present with, but they are quite different in terms of their actual effect upon the body. IBD is quite severe in how it affects the body, while IBS tends to be milder than IBD. The fact that there is some similarity and medications used in one condition seem to work in the other implies the possibility for allowing us to theoretically use natural treatments that have been shown to be effective in one in the other. It seems some commonalities of where treatment should be focused are inflammation, so helping to keep in check and control and manage inflammation in both, gut dysfunction, so helping the digestive tract to work more effectively and harbor a healthy environment from pathogens and to help support the immune system, and then 3, psychosocial factors like anxiety and depression, which seem to be quite common in both conditions with higher rates than healthy controls.